it's such an embarrassing topic for a lot of people, but
Correct.
it's so important because, like we said earlier, this type of cancer, if it is a cancer, is one of the easiest treatable, correct?
Right.
If it caught early.
Yeah, rather than living in that confusion state or
Yeah.
anxious state, it's better to get it checked out. Just once, recently I had my colonoscopy too.
Yeah. Welcome to Beyond the Chart, where healthcare begins with a conversation. This is a series brought to you by Ellis Medicine, dedicated to exploring all things healthcare. Each episode brings together experts from within Ellis Medicine and guest patients for meaningful, relatable conversations that go beyond the clinical setting. Thank you for joining us. We hope you leave feeling inspired, empowered, and more connected to your health and community. This information is intended for general educational purposes and is not a substitute for medical advice or care. So colorectal cancer is one of the most common and most preventable types of cancer. Yet, for many people, it's a topic that feels uncomfortable, embarrassing, confusing, and easy to put off. Today, we're here to change that. And here with us is Dr. Satish Muthavarapu, who is Ellis Medicine's general surgeon and specializes in colonoscopies. Thank you for being here. This episode is about awareness, education, and empowerment. We'll talk about what colorectal cancer is, who's at risk, the importance of screening, and steps you can take to protect your health. Whether you're someone who's due for a screening, caring for a loved one, or simply you just want to be informed, this conversation is for you. Early detection saves lives. And in fact, colorectal cancer is found, if it's found early, it's highly treatable and in many cases preventable altogether through routine screenings and healthy lifestyle choices. So let's break the stigma, ask the questions we don't always want to ask, and focus on what really matters, which is knowledge, prevention, and taking care of ourselves and our communities. Dr. Muthavarapu, thank you so much for joining us.
Thank you.
Yes. Let's start off with, the basic question here, which is understanding colorectal cancer. What is it and its prevalence, if you don't mind? Yeah.
Right. So the colorectal cancer is a colon, is the large intestine. We have, after you eating food, it goes into the stomach. It goes into small intestine where it gets digested, and undigested goes into the colon and comes out. We have called ascending colon, transverse colon, descending colon, sigmoid, and rectum. Checking into this piece of intestine is called a colonoscopy. And cancer in this piece of intestine is called a colorectal cancer. So there are different kind of cancers pathologically, but the most common is adenocancer. That is the most common and prevalent one. And screening for that is very important because colorectal cancer is the fourth most common cancer in America.
Wow.
After first is the breast cancer in women, second is for men is a prostate cancer, common cancer is a lung cancer, and colorectal cancer is the fourth most common cancer in America. Around 160,000 people are diagnosed every year with colon cancer in America.
Isn't that something?
There is a lot of people who have it. And these are all preventable cases, which they get a regular screening test. And if they found it early, it is treated better than finding it later.
Okay.
So if you can find, and also prevention is very important because if you find a polyp or something that is going to become a cancer, if you take it out early, the chance of it becoming a cancer are very less.
Okay.
So you're pretty much preventing it.
Okay. How much of this, because when we hear cancer, oftentimes people's minds jump to, okay, like, am I predisposed to it? How much of this is genetics? How much of this is lifestyle? For colorectal cancer, how much of it is genetics and how much of it is lifestyle?
So that is the funny thing. We always afraid of genetics. The actual genetic incidence is less than 10%. 90% of the colorectal cancer are sporadic, random people having colon cancer. So only genetic related is 10%.
So
90% is just random, sporadic.
So that's
people.
like environmental. So it's basically
environmental, eating habits, or other smoking is also related to colorectal cancer. Obesity is related to colorectal cancer.
Wow.
All these risks are there.
Right.
Men are slightly more prone than women for colorectal cancer.
Why is that?
It's probably hormonal related.
Interesting.
Yeah.
Interesting. What are some of the symptoms that people find? Because why don't we actually first touch on screening and then touch on symptoms?
Right.
Yeah.
So we recommend at this time, before it used to be age 50 to screen for colorectal cancer, but the incidence has gone up so high. People are diagnosed in colon cancer at an earlier age. So now the latest CDC recommendation is to go at 45 years of age to screen for colorectal cancer, which is helping a lot of people to identify the cancer early and then getting treated early, or prevention earlier than later.
Right. What are some of the symptoms that people could look out for? Because we're saying 45. I know someone who had it. She unfortunately passed away. She was actually a classmate of mine, and she was literally like 40 years old when she was diagnosed with it. So I'm sure she had symptoms, and that's why she acted on getting it diagnosed.
Right.
But what are some of the symptoms?
So usually most of the patients who have colorectal cancer, they may not have much symptoms.
Yeah.
But when they have symptoms, like if they see any excessive bleeding,
Right.
or if they're having abdominal pain,
Right.
if they're having weight loss without knowing, or unintentional weight loss,
Right.
or if they feel any mass when they palpate themselves, or if they are nauseous, for continuous nauseousness for some unknown reasons, it's better to check with their doctor,
Right.
and so that they're not missing anything.
Yeah, and usually they would go to their primary care doctor first.
Right. And it's better to check with the primary care doctor first. If they suspect anything, they can refer to us and we can do the colonoscopy.
Yeah. I think oftentimes what people do, especially nowadays, they'll kind of say, oh, it's embarrassing, first of all, because it's like...
That is true. That social stigma is always there when you want to do a colon cancer screening. They're worried, like, how to get it done, what are the risks, they're going to be in the room, am I going to be uncomfortable? So usually this is very professional thing. Whenever they are in the room, all the nurses, doctors, they're very professional. They do it every day.
Yeah.
They don't remember anything when we do the colonoscopy. And it is always beneficial to have it done, and people are very professional.
Yeah. Well, what I was mentioning about the embarrassing part is, I think, especially when it comes to bowel movement and bathroom habits and just gut health in general, like
Correct.
People are very private about that.
Correct.
And also embarrassed, and sometimes out of embarrassment, and I think we've all been there, where we'll be like, oh, I'm just stressed.
Yes, they don't talk about it.
They don't talk about it. They
people.
just say, okay, well, if my bowel movement does not look normal.
Correct. Right. When they get constipated, especially a lot of people, they don't complain.
Right.
They say, oh, this is normal for me. Sometimes it may be not, it is not normal for them.
Right.
They might need to get checked out, make sure that there is no mass or something that is blocking them.
Yeah.
If there is something, it's better to take care of that early.
Right.
Rather than waiting and then suffering. It is better to talk it out. Just tell your primary care, hey, listen, I'm having constipation issues for so and so time, or I'm having some bleeding per rectum, which is not there before. And these are the things that you could discuss, and you can get a quick examination by the primary care physician. If they need further follow-ups, then they can go for a colonoscopy.
How long would you suggest, let's just say, like someone was struggling with constipation, right, for like an extended amount of time? When should someone get it checked?
When it's becoming more and more problem, if they're interrupting with their day-to-day life, I would always ask them to go check it out just to make sure. And constipation is becoming a common problem.
Right.
And what the people can do is first use dietary habits, change their diet, eat high fiber foods, drink a lot of water, keep themselves hydrated.
Right.
If all those are not helping, then discuss with your primary care and see if they have some other suggestions how to help with the constipation. Even if that is not helping, then it is better to check it out and see why this is happening.
Yeah.
It should not happen for a normal person all the time.
There are some over-the-counter foods and supplements that people might opt for, like Metamucil or whatever else. So I know that's something that primary care would probably suggest.
Correct.
But if someone was to increase their fiber and, let's just say, take those supplements or whatever else, and they notice that that helped them normalize, would that be like reaffirming for them to say, okay, well, maybe not, this isn't concerning, or what would your suggestion
Yes, that's
be?
always a concern for the patients when they don't go to, when they did not have a bowel movement or they have to strain.
Right.
They always have this back off in the mind, oh, is there something that is blocking me?
Right.
Is there a mass? Is there a tumor? Why am I having this problem?
Right.
That is a common thing, but not everybody will have a problem.
Right.
So then, yes, first I would suggest increase your fiber in the food, try, over-the-counter supplements sometime.
Yeah.
If symptoms persist, then discuss with your primary care, who will guide you to the right direction.
Right. No, it's very important. And again, I think it's such an embarrassing topic for a lot of people,
Correct.
but it's so important because, like we said earlier, this type of cancer, if it is a cancer, is one of the easiest treatable, correct,
Right.
if it caught early.
Yeah, rather than living in that confusion state or anxious state, it's better to get it checked out. Just once, recently I had my colonoscopy too.
Yeah.
So, there is always, when I do so many procedures, I feel like, what do I have inside me?
Right.
So once I had it, I felt liberated.
Absolutely.
I said, like, okay, I don't have it.
It's
so
like
I'm
a check
good.
off the
It's
list
check off the list,
of
correct.
so many potential health anxieties.
Correct.
And that's a major one.
Right. It's
And
better to discuss with the primary care first and see if they need to get checked.
Right.
Most of the time, they may not need anything. There may be a little regime that primary care gives that will help them, and they're good to go.
Right.
If there is something else that is concerning, it's better to get it checked.
Absolutely.
And colonoscopy is one of the safest procedure. The complication rate is very, very low.
Yeah.
It is better to get it checked.
Absolutely. And we'll get to that in a bit because that's really important for people to understand that colonoscopies and all that goes into it is actually pretty safe.
Correct.
Well, yeah, we'll get into that momentarily. I wanted to ask you that aside from colon cancer or colorectal cancer, what are some of the alternatives when someone experiences prolonged constipation or their bowel movement? There's like pictures of like what's a normal bowel movement look like,
Correct.
and what are the concernings. And sometimes all of these may be signaling to someone that, oh my goodness, I have an obstruction. There has to be an obstruction because this is consistent. So I'll go to my primary care and I'll go get that, colonoscopy. What are some of the other types of obstructions other than colorectal cancer?
Apart from the colon cancer, people could have diverticulitis.
Okay, what is that?
Diverticulitis is an outpouchings of the colon, which are the weakest spots in the colon. So this happens over time with the low fiber diets, genetic or multiple reasons. If you take at 60 years of age, 60% of the people have some diverticulosis.
Okay.
Sometimes they rupture and they can cause severe infection, sepsis in the belly. That is one danger of diverticulitis. So people have to make sure that they are eating enough fiber and not constipated. Constipation can increase the risk of diverticulitis. So that's why people need to have enough fiber. Healthy bowel regime is always important. That also, high fibers also decreases the colorectal cancer incidence. And then when they have this diverticulitis, people may have thinning of the lumen of the colon, which will cause partial obstruction. Sometimes it can cause complete obstruction. And sometimes it become a surgical emergency.
And what are the symptoms of that?
They will have abdominal pain.
Yeah.
They feel bloated all the time.
Right.
Whenever they're having a bowel movement, rather than having a normal consistency, they may have a ribbon-size stool.
Okay.
And they have to strain a lot.
Right.
All these are the symptoms that they need to observe.
Okay, this is good to know. It's
Yes,
like note taken.
Exactly. And again, the thing is, the risk of diverticulitis is very high. Around 20-30% of the people have symptoms from diverticulitis in America.
Yeah, I can
apart
believe
from
that.
the colorectal cancer.
Yeah,
We see a lot of patients admitting into the hospital with diverticulitis. Some people need an emergency surgery because they are leaking stool into the abdomen. Some people we can treat medically.
Yeah.
Because if the hole in the diverticulitis by default is a perforation of the colon.
Right.
When that happens, people get really sick.
Right.
And that's why they need to be careful with the bowel regime. I know it is hard topic, as you said before, to discuss constipation, all those things. But it is better to talk to the primary or, follow a bowel regime so you're not constipated or not straining all the time with the bowel movements. People don't want to talk about it, but again,
everyone's going through it.
Correct.
Like, it's part of everyone's health.
It's a normal, when you discuss with your primary care, they're not going to take it as if it is a bad thing.
Yeah, they're not going to say
They're going to say, okay, this is common, and they will advise how it can be treated.
Yeah. No, that's so interesting. So I'm curious about that. I feel like this might actually be another topic.
Correct. Diverticulitis is one big topic.
Yeah, and I did not hear about it until recently. I did not know something like that. I heard of hemorrhoids, but I've not heard of...
Right. Yeah, hemorrhoids is another problem with chronic constipation.
Yeah.
I see a lot of patients in my office with hemorrhoids. Most of them, if they go on a good bowel regime, they can control the symptoms from hemorrhoids a lot.
So with all three conditions, let's talk about I can't even say
diverticulitis.
We'll practice after this.
Sure.
Hemorrhoids and colon cancer. One of the ways of preventing is actually high fiber diet.
Correct. High fiber diet, all three. It helps with hemorrhoids, it helps with diverticulitis, it helps with decreasing incidence of colon cancer.
Increased fiber intake.
Correct. Yeah. The recommendation by American Gastro Society is up to 20-30 grams of fiber every day.
Right.
Average American gets around 7 or 8 grams. So there is a good scope to improve.
Right. Any kind of, in your opinion, I know everyone's body is different, but
correct.
High fiber foods that might appeal to...
Correct. Instead of eating white bread, go with the high grain bread or brown bread, which has slightly fiber. Instead of eating some vegetables, eat extra fruit or something like that. Right. Also, vegetables are very good to add a lot of fiber to your food. Right. So add a little fiber there, a little fiber here every day. And if you don't think in the end of that you don't get enough fiber, then you can go supplements.
Yeah. Well, yeah. I think it's such an important topic because for folks, especially who grew up during the 80s and 90s, I feel like it was especially in the schools, times where everything was packaged, everything was processed. Right. And there was not enough attention put towards this should not be your normal diet. Right. And now we're starting to see and understand.
Correct. Again, high fiber foods, it decreases cholesterols. Yeah. It decreases colon cancer, decreases diverticulitis, decreases hemorrhoids. Right. It's a protective, cardiac protective. There is a lot of benefits in eating enough fiber in the food.
Right. Really important takeaway point. Now, kind of getting back to the screening process and what to expect, because I think that's what holds many people back from getting their routine screening. Okay. I got mine done a couple years ago because I actually, I think I had food poisoning, but we wanted to be extra careful to make sure that.
Just to make sure.
And I was so happy. I got an endoscopy and a colonoscopy, and I had the same feeling as you did. Not only did I feel like a new person afterwards, but I also felt like a check, off the list of potential health anxieties.
Correct.
Right?
You don't need to worry about it.
Absolutely.
And again, good thing about colonoscopy is if you find something, you take it out early. Right. And then you get treated early. And most of the time, before the polyps become to a cancer, it may take a long time. Okay. If you find the early stage like a polyp and get rid of it, its chances of becoming into a cancer are very less.
Okay. So actually, before we talk about screening, Dr. Muthavarapu, can you actually talk a little bit about polyps? Because it is common to find them, right? What's the difference between a regular polyp and something that's precancerous or cancerous? Right.
So there are different kind of polyps in the colon. We grade them as tubulous, tubulovillous, villous, and then precancer things. Okay. So in that, tubular and the hyperplastic polyps are pretty benign.
What Next, hyperplastic?
Hyperplastic is just they're enlarged mucosa of the colon. Okay. So they're not real polyps. They're just a little enlarged, but they're very low risk of cancer. Okay. And now comes the tubular cancer, which we'll know only on pathology. So that is the next lower risk group. And then tubulovillous is the next group. Villous is slightly higher. And then serrated polyps are even higher risk of developing into cancer. Okay. And then the precancerous, they have carcinoma in situ in the polyp. Okay. If there is some low grade in situ, then we can treat them. Resection is enough for them. Just taking out the polyp. If it is a high grade, then we might have to do the colon surgery. Okay. Take that piece of colon. So these are the polyps different kind of polyps that we find in the colon to look for. But the Cologuard test, these tests will give us an idea there is something, but it won't give the full option of treatment option. When you do the colonoscopy, you can treat it at the same time. So that's why still the colonoscopy is the gold standard for screening.
Sure.
If somebody for any other reason they don't want to get a colonoscopy, then I still at least get a Cologuard test, or you can go virtual CT colonography is another option.
Yeah.
These are the other options.
Okay. Yeah, and we can put some of these resources down in the caption. But yeah, that was a question I was going to ask about Cologuard, because that is something that people sometimes use
Some
as an
people
alternative.
do it.
Yeah.
Cologuard test is a test to rule out again
And it's
screening for.
Take home.
It is 40% sensitive. Not a colonoscopy is at least 90-95% sensitive.
Right.
Cologuard is 40 to 50% sensitive. But if you find something on the Cologuard, you still end up having a colonoscopy.
Right.
So those are the things. And Cologuard is done every 3 years if that is negative. Colonoscopy is every 10 years if it is all negative.
Okay.
So those are the benefits of having a Cologuard or a colonoscopy.
Okay, and that's good to know. Because that has been trending, I think.
Correct.
And I think people, the reason why they turn to that is that because it's at home.
Correct.
And they
that comfort is there with the Cologuard.
Yeah.
If they can get a Cologuard, that is fine. But they need to do it every 3 years.
Yeah.
And colonoscopy, if they don't find anything, it is a 10 years thing.
Let's talk about the benefits of a colonoscopy. Because for those who are like, I'm going to do the Cologuard because it's at my home, there's privacy, it's not as invasive.
Correct.
But obviously, colonoscopies are a lot more sensitive, like you had just said.
Right.
And let's just kind of cover take us through the journey of getting a colonoscopy. You and I know by personal experience, but like for those who haven't had their colonoscopy yet, what to expect.
Right. I mean, most of the thing people are afraid is ones who had colonoscopy, they talk about the prep.
Right.
Preparation, I know it is tough. It is not 100% easy. You need to starve for a day or two. It cleanses you really well.
Really well.
A lot of people say, I lost 2-3 pounds.
5 pounds.
Right, 5 pounds. There we go. So like that, that is one thing people look for it. But again, it is a process, especially working people.
Yeah.
It is hard to stay starved for 2-3 days.
Yeah.
Then, and then you have other ways of doing rather than doing 2 days prep. You can do a 1 day prep, and then get cleaned up.
Yeah.
But important thing is to have a very clean colon. Yes. Then you'll have a good look. So you need to do only one time. You don't want to do it 2 times. Not getting a good prep is not a good thing to do, because if it's not a clean colon, then you end up having another colonoscopy because the prep is not good.
Okay, let's talk about prep, because following those directions for prep, and that's what you're talking about.
Correct.
But following those directions are so important.
Right.
From personal experience, when I'm in the waiting room and I hear people,
right.
their stomach's still gurgling and they have to go to the bathroom,
right.
you know that they probably did not follow the directions through
Correct.
and through.
Right.
So it is important, right?
It is important to follow the instructions. And I had my colonoscopy, and a simple thing I followed is I got the Gatorade, 2 bottles, 3 bottles. Yeah. And then I added the Merolax to one of them. Mm-hmm. And I drank it 1 day before. I stayed on soft diet, pretty much liquidy soft.
Right.
And then on the day of the prep, I took the Gatorade starting, and then I took the Merolax with Gatorade, full 1 liter. Right. And then after that, I just drank Gatorade. And by night at 10 o'clock, I'm done. Yeah. My prep is done. I just kept myself hydrating till the morning. Right. And I am good. Yeah. And I looked at the pictures of my colonoscopy. They're pretty clean.
You're very clean. Amazing. Clean, good exactly. job. No, but that's what it does. It cleans you out. And for some people, they might want to take the day off from work or work remote, because you would have to be right by the bathroom throughout the whole day. Correct. You literally do get the detox of your lifetime. It really cleans you out.
It cleans up very well.
Yes. But it's interesting, because when I had done it, it's as if your body knows that it's prepping for something. You're doing prep, but because your mind is set on, okay, I'm going to get this done tomorrow. Right. It's less about starvation and more about your body knowing what it has to do. So it's pretty amazing, actually.
It is. It is not as hard as people think.
Yeah, the idea
you just
of it
have
is
to
hard.
start it, and it is some days you go somewhere and you don't eat for 12-13 hours. Yeah. It's just like that.
It's just like that.
Correct.
So it's just the idea of it, guys, that may seem really like,
Correct.
that's probably the most difficult part.
Right.
But
Once you do the
yeah.
prep, you just it's easy. You go to the hospital. There will be anesthesiologist or the doctor give you.
Yeah.
I always tell my patients this is the hard part, getting the IV line.
Right.
Once they get the IV line, the medication goes through that. They'll have the best sleep of their life.
Okay, let's talk about that. Anesthesia. That's another
Anesthesia.
thing that freaks people out.
Anesthesia is the safest thing. The risk of anesthesia is 1 in a million. That is like a documented number.
Right.
So it is very safe anesthesia now, and the drugs they have are very, very safe.
Right.
And I'm in practice for last 15 years.
Right.
I did not have one complications related to anesthesia till
that's
now.
really reassuring to hear.
Correct. So anesthesia is
Say that
pretty
again.
safe. In 15 years, I did not
15
have
years.
one single complications related to anesthesia.
Okay. And
That
it's
is very
amazing
safe.
because for most people, that is like the thing that
Correct.
kind of is the prep and the anesthesia.
Right.
that
Yeah. A
freaks
lot
them
of
out.
people say, "Oh, let me wake up safe." I said, like, you won't have any problem. That is the safest thing.
Wow.
And then risk of colonoscopy itself is also very, very minimal.
Right.
People talk about perforation, bleeding, infection. Those are there. But again, it is like 0.2%, I think, nationwide. It is very low risk
Okay.
colonoscopy complications.
Okay, that's good to know.
Yeah, once they do the good prep, even the complication goes even lesser than that.
Wow.
Yeah, it's very less complicated procedure.
So if there's any concern, it's to follow the directions for your prep.
Correct.
Because
Once-
everything else is pretty safe.
Pretty safe, right?
That's encouraging.
And then
to
within 20 minutes after the procedure, they're talking, they're walking, and they're good to go home and have their regular life.
hear. You have the best sleep ever.
That is true. A lot of people say
If
that.
anything, the benefits probably outweigh the
Correct. With all the prep, and they go to bathroom a few times, wake up in the middle of the night,
Right.
and then when they come and have this anesthesia and they have this sleep,
Right.
they feel the best thing,
Yeah.
and they feel so relaxed, and now they know they're good.
It's a good feeling.
And
It's a cause for
that's a good
celebration.
feeling for a lot of people say, I'm going to go eat nice
Yeah.
after this.
Yeah.
Yes, which they could do.
Absolutely. No, it's to have that resource
Correct.
is a major blessing. So
Right.
to not take advantage of it, you're
Right.
doing yourself a disservice in more than one way.
Correct. It's a
and-
good service, and it is available, and it's a screening test.
Yeah, absolutely. And this is going to lead us to talk about early detection and the
Correct.
importance of early detection. Also, there's the surgical perspective and treatment pathways. And so we're trying to give people a well-rounded understanding of colonoscopies and the importance of it for colorectal cancer,
Correct.
right? Early detection. So let's talk about a situation where the screening finds pathology comes back and there's some abnormality.
So what happens is when we do the colonoscopy, if we don't find anything, depending upon their history, we recommend when to repeat the next colonoscopy.
Okay.
If we find some polyps, we send it to the pathology.
Okay.
Pathologists will look at the polyps, and they will do the under microscope, and they will give the grading of the polyp.
Okay.
Depending upon their grading, we will recommend 5 years, 7 years, or 2 years. Some people, if there is some high grade issues, then we may go 6 months.
Oh, wow.
And most of the time, if the polyp has no cancer, we will go back and resect it more and relook at it, make sure it is not growing back.
Okay.
If there is a cancer in that, then we recommend surgical option.
Okay.
And and I do my own surgeries, but if a gastroenterologist does it, they send to the nearest surgeon. They do their cancer workup. And nowadays, most of the surgeries are done laparoscopic.
Okay.
And they may need to stay in hospital for a day or two. And then
Can
when
you
the
explain laparoscopic for people? who may not-
laparoscopic is doing surgery through the small holes, and one incision, small one, to take the colon out. And the pain is much better, and the recovery is much better with that. And now we use the robot, which is even safer. The pain is even better with the robotic surgery.
Like the main robot that's used is Da Vinci, correct?
Da Vinci robot,
Vinci
yes. And surgery is technically very easy. When the surgery is easy, the complications are less.
Oh, yeah.
And patient's pain is much, much well controlled, better with these surgeries now.
Right.
And they stay probably a couple of days in the hospital,
Right.
and they go back and have normal life. And then once in a week after they get the final pathology, if the final pathology shows no involvement of the lymph nodes, they are cured. They just need a 1-year colonoscopy just to make sure nothing is growing. If there are some lymph nodes that come positive, then they need chemotherapy. And the chemotherapies are not that bad nowadays. They're very safe. People are afraid of losing hair and other things. They're very less toxic now.
Right.
And there are some targeted treatments coming out now, which are even safer.
So a lot coming out right
exactly.
now.
And if you find the colon cancer in stage 1 or 2, their survival rate is around 70 to 90%.
Isn't that something?
Yeah, they have a normal life, 70 to 90% of time.
And we were just talking about this before the recording about, cases where people actually live their better life after.
Correct.
Yeah.
Because they're cured.
Yeah.
But if you find in the late stage, then the problem becomes more intense and you need further treatments. So it is always better to find the disease early rather than later.
So
that is why the screening is really, really helpful.
Absolutely.
Correct.
Absolutely. So early detection is key.
Is the key for colon cancer.
Yeah, absolutely.
Because the treatment options are much, much better if the early detection happens.
Absolutely. So another thing that we touched on before the recording was about access to getting a colonoscopy. And at Ellis Hospital, we're fortunate to have a service that makes it a little bit easier for patients, for those who are concerned, and easy way to kind of communicate that to their doctor. One being just to have a relationship with your primary care doctor, and if you feel something and it's not normal, talk to them, be very open about it with them. They may also put you on something called a fast track.
So fast track is very good option that we came up at Ellis Hospital.
Right.
So they can prevent one extra visit to the surgeon or with me or the gastroenterologist.
Right.
What they do is they can see to the primary doctor, and the primary doctor will recommend how to do the prep, and they will send them to they'll just book for the procedure, and then I meet them. They do the prep and everything, and they come to the procedure day. And I meet them, I explain them all the complications and how the procedure goes. And when they're comfortable, we do the procedure that day and they go home.
That's literally a fast track.
Really fast track, right.
Yeah.
So it avoids a lot of clinical visits.
Right.
And they're straight booking.
Right.
And then they come in, they get the procedure and they're done.
And I think that takes away from some of the anxiety that patients sometimes have when they get their screenings done, is like if they don't go through their primary care, it's like, okay, well, does the doctor have all the information they need? Like, where do I go? Like, where's all my information? Where are my records? Who needs what?
Correct.
But with this service, it's like, okay, it's like you've got your primary care working with the surgeon directly. And
correct. And once I do the scope, the primary care gets all the records of the colonoscopy or endoscopy, and then they can, when they go back to their primary care knows everything about the patient.
Already knows that information.
Exactly. And then further workup and everything, they don't need to come to my office. They just need to stay with the primary care, one doctor.
That's great. That's good to know.
That's really helpful.
That's good to know. This was really interesting. I felt like we unpacked a lot, but I feel like there's still so much more to unpack.
Sure, we can talk about diverticulitis.
We should have you back on to talk about these other topics, because it's all related. And they're all, we've had these conversations with different providers and doctors and educators, and it's amazing how everything is interconnected.
Correct. Everything is interconnected in the body, yes.
And it's so important for us to stay curious and, listen and have these conversations.
Right.
So Dr. Muthavarapu, really appreciate you taking the time.
Oh, it's my pleasure to be here
with us. And for those who've been watching this episode of Beyond the Chart, thank you for watching. If this episode of Beyond the Chart resonated with you, please like and share it with someone who you may think may benefit from it, or just share it with people, because this is a topic that relates to all. We should all be taking our health very seriously. We should also try our best to understand our healthcare system. And again, we have, if you stay tuned, we have more conversations lined up around health and the healthcare system, and how best to navigate it. So stay tuned and take what you can from these conversations. Great way to also be your own best advocate. by listening to this, because I know just being part of the conversation, that everything I take from this gives me a better idea of what I need to know to advocate for my own health. So again, thank you so much.
Thank you very much.
Yeah.